we're going to continue up the body, starting with the knee here. Going over the knee, you get a lot of people with a lot of knee injuries that are, sometimes it's in the front of the knee, sometimes it's the back of the knee. Just wherever you're moving this knot is going to be more focused on that area. So if they have issues with the patella, just put it over the patella. If it's more medial, you can put the knot a little bit more medial, okay? If you need to do a little more lateral, that's okay. Maybe they got something going on the outside. Behind the knee this way, they're going to get some different feelings in the back of the knee because the knot is back here. You can go directly over the kneecap, okay, just by closing the loops and putting it over the kneecap is a different feeling. You can go medial, you can go lateral, and even just flipping the knot over to the front, sometimes that'll hit areas of the patella that feel a little bit better. So just with one joint, I probably showed you 12 different ways to put the butterfly loop on it. All we want you to do is pick 3 angles where you find the sweet spot or the hammer and let that run for those cycles. You always want to go above and below if you can. So we're going to just keep going above. I want you to sit back in the chair a little bit, Jim, and we're going to put this under your thigh, and we can get muscles to fire because the pulse is going up and down his thigh this way. We can go right on top if we want and fire it down into the thigh this way, and even on the inner thigh. Sometimes people there's a lot of lymphatic drainage and stuff in here that can get blocked up, so we'll put it on the inside. If they feel that hammer, the sweet spot on any of those areas, we would want to keep track of where those are and make sure that we work with them in future sessions to see if those are starting to dissipate. So Jim, I have you to stand up for me real quick. Turn the machine down here a sec here. And we want your left hip, bottom of your hip bone to drop right into the ring, okay? And sometimes the hammers are way up here. Let me know how you're feeling, Jim. A little bit more, a little bit less?
That's fine.
You feel like a hammer hitting somewhere? Okay, so that's good. Basically, we're just firing it. I'm actually getting movement all the way down into the leg a little bit. So we're still firing the signal all the way down. Now we're just going to have to scoot that over into your tailbone, Jim. There we go. I'll turn it down. Now we're getting closer to the torso, so it's a little more sensitive, okay? Torso is more sensitive than the extremities are. So we'll turn this down a little bit. I'm going to pay attention to Jim. He's going to tell me if he wants a little bit more, a little bit less. Fine. And now are you starting to feel like a hammer or a sweet spot hitting you?
Not yet.
Not yet? Okay. Would it be too uncomfortable if I went too high, a little higher?
No.
No? Okay. So some people who have injuries in their tailbone, they'll actually feel this pretty quickly. So the idea is to follow the pathway up to the brain and look for those areas that might be hurting them, okay? So let's go up a little further up and have you stand up. We're just going to angle the loop into the chair right at the low back, okay? So I'll have you sit right inside there, Jim. Okay? And again, we're just following the nerve path up the spine, okay? So here comes some energy into the low back. Tell me what you're feeling. A little more, a little less. Good. Do you feel a hammer or a sweet spot now? Okay. So as soon as you find the sweet spot, some patients it's going to be down here in the calf. Some it's going to be behind the knee. Some will be in the inner thigh. For Jim, it's the low back. So if he was having any issues with his toes going numb or any kind of nerve issues, that hammer right there is on the way to his brain. Okay, so for his foot to function properly, we need to send a signal from the brain down to the foot and then send a signal back saying everything's okay and everything worked. Well, if he's got a blockage, an energy blockage in his spine somewhere, we want that to get better. We want the energy to flow through there better. So I would spend a few sessions on that spot that really bothers him until that gets fainter and fainter and fainter. And that's how you know your patient's getting better and better.